Measles is in the news so much today because there are less patients who are being vaccinated against measles. This is the MMR vaccine, or the measles, mumps, and rubella vaccine. We typically administer this to patients that are in between the ages of 12 and 15 months. And then a second dose is given between the ages of 4 and 6 years old. Because there was a research article that was released a long time ago about the fear of autism and the measles vaccines, parents have subsequently decided not to vaccinate their kids. Unfortunately, they have not realized that, first of all, that research article was not substantiated and was not true, and that they didn't realize the consequences of measles if their child actually gets it. Measles is a highly communicable disease. You can get it by just being in the room with somebody else who has measles. This person might not have signs or symptoms yet, or they might just have a rash. Signs and symptoms of measles include rash, runny nose, fever, cough, or red eyes. Usually they look like they have a cold initially, and then about 4 to 5 days afterwards they might have a rash. And then by that time they've exposed plenty of people to measles already. Usually somebody is infectious for about 21 days after they get the rash. So it is recommended that somebody who gets measles not return to work or not go to school until they're not infectious any longer. When a patient contracts measles, they start to get a runny nose, red eyes, develop a cough, and develop a fever. About 4 days later, they start to develop a rash. This rash starts in their head, follows to their trunk, and proceeds to their arms and their legs. At this time, they can develop complications from measles. This can include anything as simple as an ear infection to anything as complicated as pneumonia or even an infection of the brain. Can measles result in death? Yes, definitely it can. Usually about 20% of the kids younger than the age of 5 end up being hospitalized for measles infection. So I definitely recommend measles vaccine. No, you cannot get measles from the vaccine. The vaccine is what's called a live attenuated virus. I usually liken this to an egg. That's the shell of an egg but doesn't have the egg on the inside. So what happens is that your body recognizes what the measles virus looks like, but you don't actually become infected with measles. Now, some patients ask, if I decide not to get the vaccine now, could I possibly get it later? There's some good research that shows that 72 hours after exposure or less, you could get the measles vaccine and it might protect you against actually getting the infection. So what's the cost of a measles vaccine? If you have insurance, typically your insurance does cover the MMR vaccine. If you do not, you can actually go to your local health department and you pay an administration fee. That is usually for those who are underinsured or uninsured and their insurance doesn't cover vaccines or they don't have insurance. For further information about the measles vaccine, please come to my clinic and see me for an appointment.